Hello, so for this genetics research assignment, I will be talking about Tourette syndrome, TS for short. In this presentation, I will be covering some information about what it is, its history, how to be diagnosed, causes, and I will be showing you some data and statistics. So, what is Tourette syndrome? It is a condition of the nervous system which causes people to have tics. Tics are uncontrollable sudden movements and sounds that people do repetitively. This is a short video I've found that shows what tics are. This video is a minute long, so I will be skipping through some parts which enables me to talk about more information without prolonging this presentation. As you saw from the video, each individual made repetitive movements. Those are what you call tics. Now, there are two types of tics. One is motor and the other is vocal. Some can be simple like eye twitching, head jerking, grunting and coughing, while some are more complex where the individual can't stop touching or smelling objects, bending or twisting, and using vulgar languages. So does this affect the individual's life? Not necessarily. Although it can cause discomfort or embarrassment, can occur while sleeping. It can interfere with activities, but only if tics are severe, and it can worsen if the individual is ill, anxious, tired, or excited. Now, the man behind the name Tourette syndrome came from Georges Albert Edouard Brutus Gilles de la Tourette. He is a French neurologist who was born on October 20, 1857 and died on May 26, 1904. His journey began when he attended a medical school in France at age 16, and in 1884 he began to examine paroxysmal motor disorders. He then published a report of patients who shared similar conditions, which were what we call tics. Marquise de Dampierre, a noblewoman, was one of the patients and was also the first documented case of the Tourette syndrome. He looked at his patients' backgrounds and saw that there was no connection, so he theorized that Tourette syndrome must be hereditary. He started a debate in the medical community about the origin of Tourette syndrome, which didn't end until the early 1970s. The debate was won when the father of modern tic disorder and his wife successfully persuaded the media and the medical community that Tourette syndrome was neurological rather than psychological. And that led to our understandings of Tourette syndrome. Tourette syndrome is not some type of disease, so when being diagnosed, no laboratory tests or brain scans are needed. Medical experts observe the patients and do necessary tests to see if the patient has Tourette syndrome. But to be diagnosed, an individual must meet a set of criteria. This criteria includes at least 2 motor tics and at least 1 vocal tic. Tics have continued for more than a year. Tics began before turning 18, and tics were not caused by other substances. So what happens if you have Tourette syndrome? Well, there's no cure, but it does not affect everyday life activities, so treatment is not really needed. In the case where the tics are severe, medication and behavioral treatments are available. Now, tics usually begin to show at ages 5 to 10, but tics gradually decrease as a person grows older, and it might even disappear completely. Also, a person with tics does not mean they have Tourette syndrome. As I've said earlier, Tourette syndrome is hereditary, so your genes play a big role. Studies show that it is a dominant gene. A male with Tourette syndrome in their gene is 3 or 4 times more likely to show symptoms than female. However, scientists continue with their research and found that Tourette syndrome can be triggered by the breakdown of dopamine in the brain. They are also researching if there are some environmental risk factors like smoking during pregnancy, low birth weight, and infections could contribute to the development of Tourette syndrome. To end this presentation, I'd like to show you a chart that compares children with and without Tourette syndrome that have another mental, behavioral, or development disorder. So this chart dates back to 2012 when the survey was created for 65,540 US children. As you can see, about 63% had ADHD, about 49% had anxiety, about 25% had depressions, and about 29% had speech or language problems. So to summarize, Tourette syndrome causes a person to make involuntary movements and/or sounds. The French neurologist Gilles de la Tourette had conducted research about Tourette syndrome and its origin. in which we found out that it is actually neurological rather than psychological. There is also no cure, but it doesn't affect daily activities or the way a person thinks. And children diagnosed with TS can have another disorder. I learned about Tourette's syndrome, and one thing that stuck by me is that having tics does not mean you have Tourette's syndrome. My brother has tics where he flinches at random times, and I looked it up before and I just saw that Tourette's syndrome, so I thought, this might be it, but I was enlightened after this assignment. So that concludes my presentation, and thank you for listening.